Hello, I'm Bruce Johnson. Thanks for joining us on Off Script. GOP efforts to repeal and replace the current affordable health care law have all but died. President Donald Trump wants no part in fixing Obamacare. He says let it fail. We're asking a panel what that means to you and your family tonight. But first, here's a question for you at home and online. Do you think Republicans and Democrats can ever work together to fix health care? You can have your say by going to WUSA9.com/vote. Here's what the president had to say.
I am disappointed because for so many years I've been hearing repeal and replace. We'll let Obamacare fail, and then the Democrats are going to come to us and they're going to say, how do we fix it? How do we fix it? I'm not going to own it. I can tell you the Republicans are not going to own it.
Dr. Leighton Koo is director of the George Washington University Center for Health Policy Research. Dr. Danielle Dooley is the medical director for community affairs and population health at Children's National Hospital. Thank you both for joining us. In your minds, where are we now when it comes to health care and the GOP plan to repeal and replace Obamacare?
I think it's important to remember that this policy debate was about real people, real children, and real families. They are still worried about how, and these are families I see in my practice every day, and they're still worried about how they're going to be able to access their medications, their subspecialty care. They feel anxious and stressed, but they're incredibly resilient. It's important to remember that parents of children with disabilities and special needs, so parents of many children on Medicare, are incredibly tough and will fight for their children to get what they need.
Yeah, where are we now?
So for right now, it looks as though the efforts in Congress have failed or stalled. The next question will be, will there be things that the Trump administration will try to do to push Obamacare a little further down? So he says, just let it fail. The administration has the capability to sort of try to make it a little worse for it. And so that's the question of whether they'll do that. The risk is if they do that, then as people will say, if it fails more, it'll be on his hands and it'll be on the Republicans' hands. And does he want that?
And a lot of people, including people that voted for President Trump, are asking how the president can say this. It's now on him. If there is no health care, and you've got the president saying let it fail, which means he's not going to do anything to help it, where are we when it comes to taking care of our family, our children, our friends, and others?
I think it's an incredibly important time, for the patients, the families, the doctors who advocated so strongly on behalf of this issue to show that we're all willing to continue to try to work together going forward to craft solutions to some of these issues. Medicaid is the most important investment in our country's future and in the future of our children.
Okay, the president says let it fail, but Medicaid will still be there for those that need it.
Absolutely. It's been there for 50 years. It'll continue to be there.
Okay, and if you have a health care plan under your employer, does any of this affect you? Should you be concerned?
For right now, it shouldn't change things at all. Things are staying the same. The part that's most at risk are the health insurance exchanges. But there too, without changes, they ought to be pretty stable. But nonetheless, Dr. Dooley's absolutely correct. People are feeling nervous and insecure. And this is not only patients, it's doctors, nurses, and it's the rest of the public. And there are things that the president or Congress might try to do to assuage that, but they're trying to use more scare tactics.
And I think across the board, people are trying to remind them that you were sent to Washington to fix things, not for more of this chaos, right?
I think that's right.
Absolutely.
Thank you both very much. Okay, we hit the streets to see what some are saying about the GOP health care fail.
At a minimum, we need to preserve what we have with the Affordable Care Act because we've extended health coverage to millions of Americans, and it would be unfair and unjust.
The population, the citizens of the U.S. aren't ready to give up the government's role.
The right to pursue happiness does not include the government paying for health care. Where's it going to go next? You're going to buy all my food for me?
Well, I think it needs to be just more financially sustainable, right? And we need to continue to look at bringing costs down.
Because a lot of people I feel are upset that their policies went up a lot.
I would like to see Congress actually work together and to try to actually make a difference where people could really get some help and relief that they need instead of bickering around about things on and on and on.